So hip replacement and hip arthritis, the general idea is this is a thigh bone, this is the ball of the bone right here, and this is where most of the arthritis occurs, as well as in the cup or the socket or the acetabulum of your pelvis. And what happens is the cartilage, which is the smooth layer on the end of the bone, gets worn out. And when the cartilage gets worn out, you hear the term bone on bone. Well, that's basically correct. The bone is rubbing on the bone of the socket, and there's more pain, and it's more stiff. And you get bone spurs. And the idea of a hip replacement is we remove this painful old ball, the arthritic ball, we make a cut and remove it, and we place a metal stem. This is an idea of what a metal stem looks like, or a hip replacement stem. There are literally thousands of different kinds that are all different shapes, all different kinds of metals that all meet different needs. Some of them are very similar. They have all different ideas and properties, so I can't go over each and every one of them, but the general idea is that we place some sort of metal stem inside the canal of the femur bone. This is the ball, which is a lot of different options that we can use. This is a metal ball or cobalt chrome ball, which is the most common type of femoral head that we use. Other options are ceramic, and the ball comes onto, it's a modular design where we can change this out if we need to, if there's any sort of problems down the road. This is the second part of the hip replacement. The first part is the stem of the femur or the thigh bone. This is the second part. And the general idea that we do here in the United States is we put a metal, non-cemented cup, which some doctors, including myself, put some screws to hold it into the pelvis or into the cup. And then the key part of this is the plastic or the liner. Now there's all different kinds of liners, and there's different options for every different person, and each of these have different risks and benefits. This is the gold standard. This is the polyethylene or the plastic. So when you hear somebody talking about a metal on plastic, this is the plastic part of it, and this is what wears, and we're thinking that it wears about 15 to 20, 25 years is what we're thinking right now in a normal wear scenario. The other options again are metal and ceramic for this. So it can be a metal on metal, a metal on plastic, ceramic on ceramic, or ceramic on plastic are all the general ideas that we use. So once you replace the hip bone or the thigh bone with a stem, which is like the one we saw, this is what it looks like where it's inside the bone. It becomes instantly solid. In the United States we do a non-cemented for the most part. This is what the cup looks like once it's implanted into the pelvis or the acetabulum. The white part right here is the plastic, the polyethylene, and when the cup gets put in and the hip gets reduced, this is what a functioning hip replacement looks like.